unlike traditional physical therapy,
Yeah.
where you said they just give you the printout, they take it. Oh man, my grandmother's had a hip replacement. She's had a knee replacement, and still, when I go to her house, it's been years.
Yeah.
She still has those papers pinned on the fridge.
Yeah.
And I'm like, Granny, you did this stuff? No.
Yeah.
So you have to really
Exactly.
just explain to people why they're
Yeah.
doing the thing.
Hey there, my name is Raul, and I am a recovery coach here at El Paso Manual Physical Therapy.
Hi, I'm Jay, and I'm also a recovery coach here at El Paso Manual Physical Therapy.
And this is
Joint Effort.
This podcast is powered by the Knee Arthritis and the Hip Arthritis Recovery Programs. In this podcast, we will give you a sneak peek into what it's like to be in our private community, from which we're going to be pulling questions.
We're going to be going over some ins and outs on how to make the most of your recovery program. We're going to be answering questions directly from the community and bringing them to you. So if you'd like your questions answered during this podcast, you'll need to be a member of our Hip Arthritis Recovery Program or our Knee Arthritis Recovery Program. And inside you will find
over 50 videos of education. You will find live coaching with us, the coaches, and Dr. David. And you will also find a private community that is very supportive and can help you push through your goals. Coach Jay, how are you doing?
Good, man. How are you, Coach?
Good. Hey, really good job today on those coaching calls.
Thank you.
So before the coaching call, there was this question that came up, and it was from Cecilia. And she's asking, I'm wondering why or if it's necessary to get my glutes to burn when I'm exercising. I do get shaky after doing a few reps, but I do not burn or get sore. Does anyone get them to burn or get sore the next day? And this is a question that Cecilia is making towards us and the community. So first of all, how would you approach this? Keep in mind, for everyone who's listening and has no context, our recovery programs have 4 phases. And in these 4 phases of recovery, first we try to work through not being irritated. Then the second phase of recovery is where we try to get the person to feel their muscles better, which is where I think Cecilia is at this time.
Yes. So again, phase 1, we're trying to get the irritation to calm down, any swelling, any just lingering pain, getting out of bed, keeping you up at night. It just makes day-to-day life very uncomfortable. Phase 1, we're trying to break through that. In phase 2, we start activating.
Yep.
And through activation, we're looking to just gain a better consciousness of the muscles that we need to strengthen to help cure the root problem, which is the muscular imbalance. So for Celia here, I would assume that she's in phase 2. I do want to make sure of that. But we're working on activation. At this point, we're not really worrying about strengthening, but rather feeling the muscle. How would you go about getting her to get that sensation, Coach?
Usually what I see is that people that have pain become more sedentary over time, and this leads to them not being able to feel their muscles anymore. And especially the glutes, because modern life, we just tend to sit on our butts for the majority of the day. So what she's experiencing right now is more of a mechanical thing, but she doesn't have that internal focus of control where she can actually feel her glutes. So if I was talking to Ceci directly right now, I would say, you probably just need to wake them up. You need to do 10-second holds, and you need to do them all day because an activation that is more of a neuromuscular nature takes more time to develop. So she's probably not feeling the burn, not because she's not doing sufficient exercise. It's just because she doesn't understand yet how to bias or feel her glute muscles. And this just comes with practice, in my opinion.
Well, you did mention something that I like to double down on, and that's the 10-second hold.
Yeah.
Why do we do that, Coach?
So basically, the 10-second hold, what it's going to do is going to improve the connection between the motor cortex and the neuromuscular junction, or wherever the muscle is. So basically what it is you're just paving the road for having a better mind-muscle connection, if you want to call it that. And if you don't have that, then it's going to be very hard to tease out the right muscle that you want to use. Case in point, if you're doing a squat and you feel like your glutes are not doing anything, your butt's not really working, it might not be just because your technique is off, it's just because your muscles are just not that active. So doing those 10-second holds actually makes the muscles kind of wake up. And we say wake up in a very non-sciencey way, but there's a lot of science that backs this up.
Yeah. So that that whole principle of activation in phase two is very important. You want to take your time. I feel like people like to rush through this phase.
Yeah,
And to me, it
absolutely.
is the
Yeah.
most important. Everyone wants to make it past this in a couple of days, a couple of weeks, but
Yeah.
it does take time to wake up those dormant or quiet muscles that are just not used as frequently as your quads, right? We talk about the muscular imbalance, and
Yeah.
that's usually where your quads or the front of the thigh are more dominant
Yeah.
or more in use than your glute muscles,
Yeah.
which are just a bigger muscle and they can handle more force output and absorption as well. So
Yeah.
phase two, the 10-second hold is on most of the movements that you have there. So in
Yeah.
this case, wrapping it around to Cecilia's question, I think she's on the right track. Just keep at it. Consistency, hourly, right? We asked for
Hourly, yeah.
hourly with
Yeah.
the 10-second hold, the activation.
Yeah. And the reason why we ask for this to be done hourly is just because your nervous system works that way. When you lift weights, I'll just put this into context. Like if you're someone who's in phase 3 or phase 4, which is the phase of the program where the treatments are more, they're more about mechanical tension on just getting your muscles bigger and stronger in a way. Um, when you lift weights, you can lift weights once every other day, and
Yeah.
like your body won't lose the gains that quickly. But when you're talking about something like this, that is just a contraction where the muscles are not changing in length, you're just tensing up, you're prone to losing this very quickly because it's an adaptation that is not gonna stick unless you do it very, very, very often. And it can be overwhelming. We did have a particular situation last week where there was a person who felt like that was too much work, or that it would be overwhelming, because we're talking about doing this on your waking hours, every hour
Yes.
for 10 seconds, doing at least 10 repetitions per set. And that'll take about 2 minutes and 40 seconds
Yeah.
if you do the math.
Yes.
Stack another exercise on top of that, and now you're looking at almost 5 minutes or more than 5 minutes of doing exercise. It on paper it sounds a little bit out there,
Yeah.
but if you really think about it, it's not that much. 5 minutes is not that long, and that's what we're asking of our folks when they're in phase 2. We just want them to become better at teasing out their glutes.
Right.
We want them to almost give the glutes a brain of their own.
Yes, yes.
If you will.
Dr. David, he says it in most of his YouTube videos. He talks about becoming obsessive. And this is the phase where you need to obsess. 10-second hold, it isn't that long.
Yeah.
5 minutes is a very short time out of an 8-hour day, right? I think we can spend more time on our phones in 5 minutes. So just think of it this way: while you're on your reels or you're checking your family's Facebook posts, squeeze your glutes.
Yeah. So that was a really good contribution from Cecilia. I think
Thank you.
It's one of those questions that everyone else who reads the answer can benefit from, or anyone who listens to this kind of conversation can actually get something out of it. Earlier today, you were talking to, I believe it was Johnny, and he was having some of the same issues before, where he would do some exercises and he just couldn't feel the right muscles turning on. So it's just a matter of practice. It's like everything else, but in this case, because we're talking about muscles, and muscles are way too important for your general health.
Yes.
To keep strong. I think it's one of those things where it's important that the person becomes very consistent and does it every single day, even if they're feeling better. Even if you're feeling great, you should keep on going, and then move into more difficult exercises later on.
So I believe Cecilia has only been with us for a short time.
Yeah.
Whereas Johnny's been with us for 4 months now.
Yeah.
And in that 4 months, the beginning of these group coaching calls that we have, he showed up looking a little down.
Yeah.
Almost lacking a little bit of color in his face, right? You know, he just looked a little sad, and that's normal when it comes to dealing with something like arthritis.
Yeah.
You're in constant pain.
Yeah.
You have a lot of people talking to you about just getting the replacement surgery or injections. And through this program, we're giving you guys the keys to have freedom. We want you not to be tied to what your doctor's saying or your friends or family members. So it's these things are so simple that they
Yeah.
almost seem like they won't work.
Yeah.
But
yeah.
we've seen great success
Yeah.
by the people that are consistent. They show up
Yeah.
and they lean on the people in the community. So
Yeah.
I like that we're getting those questions in
Yeah.
there. So somebody that's lacking a little bit of trust,
Yeah.
they can get that like, oh, maybe this will work for me.
Yeah, exactly. I think our parents and grandparents, they're all used to the quick fix, and it's not really a quick fix. It's just that that's the medicine that people usually get. You know, like either an injection or surgery or something else. And in our context, exercise is medicine.
Yeah.
And we're just trying to dose it appropriately when we talk to folks, and when we talk about not replacing a joint. If you haven't figured it by now, we're anti-joint replacement coaches
Yes.
here.
Yes, we are.
We don't want you to replace your joint. We actually want you to fix the root muscle imbalance so that you don't put that much pressure on the joint. And this can only be achieved through your muscles. Like your muscles are the ones who kind of tug away at your bones, and if you have a muscle imbalance, then you're going to have undue and unnecessary pressures on the joint. And seeing someone like Johnny just kind of like become less pale and just become more active, and even figure out different exercise for himself. It's pretty cool to see. I think this is why it's so important to teach people the concepts, or
Yes.
like educating people on what they're supposed to be feeling, rather than these are the 3 exercises that you need to do. Put them on a little sheet of paper, print it, and go home and just kind of forget about it. You pin it to your fridge, not even do it, because there's no explanation behind it. And I think what we're doing here, or the effort that we're putting in here together, is teach people why they're doing things so that they can become better at it, or so that they can do some problem solving by themselves.
Right. I think that's the biggest part of this, right?
Yeah.
Any recovery program that you may be on is the education.
Yeah.
You're paying for a service, but in my opinion, it's priceless.
Yeah.
Because you're learning tips and tricks. You're learning the tools that are needed. You're learning why you need to be doing these exercises. Unlike traditional physical therapy, where you said they just give you the printout, they take it. Oh man, my grandmother's had a hip replacement. She's had a knee replacement, and still, when I go to her house, it's been years.
Yeah,
she still has those papers pinned on the fridge.
Yeah,
and I'm like, Granny, you did this stuff? No.
Yeah.
So you have to really just explain to people why they're doing the thing.
Yeah.
And once they have a better understanding, it makes it priceless. It really does.
Yeah. And who knows, maybe the exercises that are printed and pasted on her fridge, maybe they're great exercises, but without compliance, then it doesn't matter.
Right.
Like if you're not doing them, then it's not really going to make a difference. So this is where I think certainty comes in. Like having a community has been very valuable, because there's someone that's maybe coming in with a hip or a knee that is very irritated, and is seeing someone else in the group that's already in phase 4, and it's doing great. It's going on hikes, hanging out with the family, and that gives you certainty of the things that I'm doing here are actually working for my benefit. They're just not blowing up smoke here. I'm actually doing something that is proven to be effective, but there's still a lot of work to be done. We still have, we've helped a lot of people so far, but we still want to help a few thousand or hundreds of thousands more to heal their problem naturally.
So there's knowledge, and then there's applied knowledge.
Yeah, exactly. Yeah.
And here we're giving you both. We're giving you the knowledge, the why, the win, so to speak, and then you're just able to apply those things you're learning here. So
yeah, absolutely.
It's great. I hope you guys can join us on those recovery programs and get the ins and outs on how to combat your situation.
Yeah. So thank you all for listening. This is the very first time we do this, so we're looking to do this many more times in the future.
Yes.
Okay. So thank you all.
Thank you guys.
That's all for joint effort.